now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
The coronavirus disease, also known as COVID-19, as it were, started somewhere towards the end of 2019 in a place in China called Wuhan, in the Hubei province. And people were falling sick, and some of them were dying. And it was also observed that people who came close to those who fell sick also became sick with time. And the pathogen, as the virus, was isolated, and it fell into the class of the coronavirus family. Coronaviruses are RNA virus that has something like crown on their surface when you look at them under the microscope. So that's where the name coronavirus came from. It's not the first coronavirus disease that is known, but this one is novel because it's a new type. There are other coronaviruses that have caused illnesses in the past, like the severe acute respiratory syndrome and the MERS. But this was entirely new and it was not understood. So from China, it spread to other parts of the world. And right now, as we speak, the WHO has declared it to be a pandemic. A pandemic is an epidemic that has gone around most parts of the world, and an epidemic is a particular disease that is affecting a lot of people at the same time in a particular location. So what are the symptoms of this disease? First of all, it starts with something like an upper respiratory tract symptoms like cough, sore throat, catarrh, sneezing. Then afterwards, there will be fever. These are the body's response to the presence of the virus. And then in many patients, they will have difficulty in breathing because it's a respiratory infection. And when breathing difficulty ensues, that's most likely the serious case. And if nothing is done, a lot of the patients will die. Even when something is done, many of them will still die. But the percentage of people who have severe symptoms are few. They are less than, let's say, 5%. So majority of people who have contracted this virus will not have symptoms. And the fact that they don't have symptoms does not mean that they cannot pass on the virus to others. And that's the risky part of it. And that's why there's so much emphasis on social distancing and hygiene. So it just keeps spreading. And the first incidents that happened in Nigeria, the first recorded case was somewhere around late February of this year, somewhere around 27th of February. It was an Italian man who is still yet unidentified that brought it into the country when it came in from Italy, where the virus is endemic. And somehow he infected a few other people. And then others have also brought it in from UK and all that. And as we speak now, there are about 274 cases in the country, and it's gradually spreading. But the authorities are doing everything to contain it. And part of those efforts is the stay-at-home order given by the president, because it's expected that if we reduce the social interaction and take precautions like washing of the hands, using a face mask when we sneeze, or sneezing into our elbow, and so on and so forth, it will help to reduce the number of cases per time. And that's where we use the word flattening the curve. So it's very important for us to flatten the curve, because if we don't, if the number of cases rises above the capacity of the hospital or the healthcare system, we're going to have a lot of mortality. People will die, not necessarily because the disease is too severe, but because the healthcare system is overwhelmed. And that happens when you have so many patients at the same time. You may not even have bed space for some. Those who will need ICU care will not have ICU beds to go to. And so because of that, we need to limit our movements. We need to take precautions in order to keep the number of cases low. So it's important that we understand the principles on how to avoid infection with the virus. What is said is washing of hands is very important, and in fact is the cheapest and the most effective way of keeping the virus away. We wash our hands with soap and with water, because the soap, the chemical in the soap, tend to put puncture holes on the surface of the virus and it kills it. But that washing of hands has to be sustained for at least 20 seconds to give enough time for the soap to react with the virus. And then two, we need to observe social distancing. And it's not a joke, because a lot of people take it for granted. When the president has said stay at home, people go partying and come out, to do all sorts of things that are not even important. The reason is because people who have the virus may not be sick, but they have the potential to transfer it to other people, and those other people can become sick. And so the risk is there. There are also some myths about the virus. People have said all sorts of things, that ways in which they can stop the virus from infecting them. Some people have, because the hair is alcohol kills the virus. Yes, alcohol in hand sanitizer, about 70% alcohol with some other things mixed together. You use it to sanitize the hands regularly where you cannot wash your hands. But the use of other alcoholic drinks like beer and all that, it's not making sense. You cannot protect yourself from that. Some people have even gone to the extreme measures of drinking hand sanitizers in the name of trying to prevent coronavirus. That's not necessary. The basic things that we have said here will help us in preventing the virus from attacking us or infecting us. Alliance Hospital came into existence in 2011, and the idea behind this was very simple. There was a gap in our healthcare system that needed to be bridged. A lot of people talk about the problem. They talk about the fact that Nigerians go abroad to receive medical care. Nigerians are wasting a lot of money going for treatment outside the country. So I thought to myself, I cannot be part of the problem. Let me be part of the solution. So that's how we assembled a team of experts and we set up Alliance Hospital. And it was supposed to be a side hustle, as it were, because I have a main job I was doing. So over time, what was supposed to be the side hustle has become so big, and it's made a lot of impact, and it has created a dent in medical tourism figures in Nigeria. So what are the things that we have been able to do? First of all, we needed a proper structure, which God gave us. And then we also needed to equip. And so we do this equipment through different levels of partnerships. we met with manufacturers of high-tech medical equipment like CT scan manufacturers, MRI manufacturers, echocardiography, and so on and so forth. So there was a payment plan, and so the burden was less, and so we acquired this equipment. Then we also have partnerships with foreign doctors and foreign hospitals, and so they also came in with their technical expertise, and many of them are resident within the hospital, rendering high-tech services. So once you have a combination of human resources for health and equipment, there's no limit for anybody, that have the combination of those two, and that's what Alliance Hospital has. So we were able to do things that before now could only be done abroad. Things like open heart surgery. We do quite a number of open heart surgeries in this hospital every year. Kidney transplant has become a commonplace here. Yes, we do 20-something kidney transplants last year. This year alone, we have done like 7 kidney transplants, and the aim is to go to 300 kidney transplants per year. Yes, that may not address all the needs, but it will create a significant dent in the numbers that are trying to go abroad for these services. And of course, you can't do kidney transplant without having a dialysis center. So we have a kidney dialysis. That center, the services there would keep people alive before they're able to prepare themselves for the kidney transplant. Then I'm an orthopedic surgeon, so we're into quite a lot of orthopedics practice, like treatment of fractures, correction of limb deformities, and limb length equalities, and we also we are very strong in joint replacement, and that's one of the things that take people abroad, because as we get older, our joints fail, either from previous injuries or overweight, or just from natural dispositions. The joints begin to fail, especially the hip and the knee. So we do hundreds of joint replacement surgeries in Alliance Hospital every year. In the US, a joint replacement surgery, let's say hip, is about $35,000. Yes, and here it's done for less than $2 million. $35,000 at this stage, you know how much that is? Well over 12 million or thereabout. But compared to less than 2 million. And then even in India, it's a lot more than this. Then we're also involved with cardiothoracic surgeries, with spine, brain and spine surgeries. The reason we're able to do some of these big surgeries, cardiothoracic, heart surgery, kidney transplant, brain and spine, especially for tumor and for bleeding, people who bleed into their brain, either from accident or from a stroke. The reason we are confident in doing these things is because we have a very strong intensive care unit. Because after you do some surgeries, patients will not be able to breathe for themselves. They are not conscious. You need to put them on life support for them to go through the turbulent period before they are able to pick up themselves. So we have a 5-bed intensive care unit we have about 7 ventilators. So we are strong in terms of critical care. And that's another area that is lacking in the country, critical care. So if people have accidents, severe accidents, or people suffer severe stroke, they become unconscious, sometimes they won't be able to stay on their own. You have to put them under the life support, the ventilators. So they are there for anybody who needs that. We also do the everyday practice, obstetrics, gynecologists, fibroid. We have a special care baby unit for neonates. We have pediatricians that take care of the kids, and we have obstetrician gynecologists who also take care of the pregnant women. So it's like it's a complete setup. We usually would say that Alliance Hospital is a one-stop shop for multi-specialty care. Chances are that when you come to Alliance Hospital, you are not likely going to go outside for anything because you have almost everything under one roof. And that's one advantage that we have. As a hospital, one of our strong principles is helping the less privileged people, giving back to society. And many times we've been involved in free surgeries for people who could not pay. Last year I saw Coach Kadiri Kana on television begging for help. That man served this nation with his youth, and he had the two hip joints were completely damaged and his spine. And I sent for him. I called the TV station and they brought him to to this hospital. And his total cost would have been 9.5 million because he needed to have a spine surgery and both hips. We offered to treat him free of charge. We have done the two hips now, which would have been 5 million, and he's waiting to do the spine. The last time I saw him walking, I was so happy because his life is completely transformed. There was another young man that I saw on one of the sister television stations. He had a jaw tumor and the tongue was pushing forward. He was going to suffocate to death. He was crying for help. So I invited him to the hospital. He had been given a bill of 3 million somewhere, and he didn't have the money. Young man with 2 kids. So we took him in and did the surgery for him free of charge. And the guy was so excited. He's back. The last time he called me, he said, "Doctor, I'm doing well." There was another young man I saw when I went to watch football at the stadium. He was walking with his legs, the outer part of his leg. He had neglected club foot. And I asked him, why are you walking like this? He said his parents are poor. They couldn't help him. So I invited him to the hospital, and we managed him. His treatment lasted for 6 months. After serial casting, we did surgery to reconstruct the foot. Now he's walking on like every one of us. For the first time in his life, he's a 14-year-old boy. For the first time in his life, he will put his feet down to walk. And the last time he came, he asked me, he said, "Doctor, sir, what would it take to be an orthopedic surgeon?" He said, "I want to be an orthopedic surgeon." I said, "Why?" He said, "Because I want to help people." So these are just some of the few examples. Even last week, one of the patients from the Human Rights Radio was sent to us. He had a fracture. And the young boy, just a young boy, and I know that his father didn't have the means. And Mr. Honorary President is doing a lot of great job. I just wanted to be part of what he was doing. Though he sent him to me and said, "Doctor, send me the bill." But I know he already has a lot in his hands. So I treated the boy for free. And so they just keep coming every now and then. This is one way that we are giving back. And they will also have lectures from time to time, and we do free consultations from time to time just to help those who might need our services. I thank God for the CBN governor who announced the stimulus package for healthcare. So we are taking advantage of that. We're setting up a new wing, and we are expanding the scope of our services because we have actually outgrown the level we're in now. So in 2 years, in the next 1 to 2 years, we would have concluded the new phase. Then we have a long-term 5 years program where we want to build one of the biggest facility, and it's going to be a compact. It's going to contain both hospital services and healthcare education, medical school and all that. They are in the pipeline, but we're taking it one step after the other. So we want to render free consultation services for people at home because they have a challenge coming to the hospital. So we want to send out our app such that they can get in touch with us. If they have issues at home, medical issues, they can call us and we would render free consultation for them. It's only if it is beyond what they can handle at home, then we can get them to come to the hospital. This will be for free. And we feel this is one way of giving back to the society in this time of a lockdown. As a hospital, as a private enterprise, we work with a lot of government agencies and departments. Many of them are regulators. They regulate the practice of of private hospitals or hospitals generally in the FCT and in the country. For instance, the Medical and Dental Council of Nigeria, you have to register, and you have to be registered with the Medical and Dental Council. You have to have a license before you can practice medicine. So both myself as a surgeon and this entire staff, clinical staff, they must be registered with the council. Then we also have the private hospital registration committee in the FCT, which makes sure that the register, without their registration and their license, you cannot practice in the FCT. Then we also have we deal with the FIRS, of course, for purposes of internal revenue service and the company income tax and personal income tax. Then we deal with the local government, AMAC, the local government, that's where we reside, for issues around tenement rates and signage fees and so on and so forth. So we are surrounded a lot by these agencies. But in terms of those who do business with us, we have the NNPC, we have the Central Bank of Nigeria, we have the Security and Exchange Commission, and many of the both government and public enterprise, and we're having a very good relationship. Fellow Nigerians, my name is Dr. Christopher Otabo. I'm the team leader for Alliance Hospital. I would like to use this opportunity to pledge our loyalty to the administration of President Muhammadu Buhari, the President of the Federal Republic of Nigeria. I thank you, Mr. President, for all that you do and for your fight against corruption and for sustainable development of Nigeria. We are with you in this fight. May God help every one of us.